Well, before, like in the past, I never had an experience of working with a hygienist. We just had uh, a new grad hygienist working with us, like, for 3 or 4 days a week, and never got to know how to work with a hygienist because I was so clinically involved that I didn't get a chance to train her. And guess what? Like within, I think 3 or 4 months, she left the practice. She was so, felt unsupported. And then we had Kay joining our practice. She was working 2 days a week. And um, yeah, just didn't have much interaction with her working. Uh, but then I think we worked with Kate for like a few months. Uh, I think around 8 to 10 months until we met Sue, and we started this protocol early this year, and it's been amazing. The whole lock-in protocol has been so amazing. It just fascinates me how when I went through all those lectures provided by Professor Larkins, how how the oral pathogens are linked to systemic disease. I just read it basically. Theoretically, I had some knowledge, but never practically implemented it until we had the microscope and we started the training. And the whole team was blown away. They really appreciated this new technology in the practice and the way how it has impacted our practice. I think the numbers would shows everything. Kate was working 2 days a week, and now she's working obviously full time, like 5 days, and she's booked till February next year. And I was always.
Are you serious?
Sorry?
Are you serious? Because only 2 weeks ago she was booked till December, and now she's booked till February.
Yeah. And I think I think I did mention Sue a few 6 months ago that I wonder how a few dentists I've met, they say I have 3 hygienists, I have 5 hygienists, and I was wondering how does that work. Until now, I can see we have a target, how Sue, when we started, that by end of next year we probably will have 2 or 3 hygienists in the practice. I think the whole thing which fascinates me is the way how the patient are emotionally engaged in in the treatment, and less cancellation basically because they see what's happening in their mouth right in front of them on a big 50-inch TV on a screen, and less cancellation, more patient retention, and more than that, I think it just gives a hygienist, Kate, who's been so amazing to implement this in the day-to-day practice, that it separates them apart from just the normal treadmill hygienists, So, and I just love the way how she's on board with this, new service in our practice. The patients are so, emotionally engaged, and it's been amazing.
And you have such kind things to say about it, and I know with all of my experience, the minute I saw this, light bulbs just came on, and I went, "This is how we need to practice dentistry." But can you? I'm pretty sure you have not spent a cent on marketing. Like I have this really big. I have this really big belief that money doesn't need to be spent on marketing. And I'm sorry to all the marketers that are in the room. I know we need new patients, but if a patient has to go somewhere, why would they choose you? And Tom was actually talking about that patient and customer experience. But to grow your practice in the last 6 to 8 months and the hygiene department, you haven't invested in marketing, have you?
Nothing, 0 cent now. I think it's in itself, the patient sees the value, how just Professor Larkin said, patient value, if you value what, what service you provide. So it's a value in itself, I just love that test, teach, treat and repeat. That's such an important statement. And it's in the market in itself, we don't have to market because patients see what's happening in the mouth straight in front of them, and seeing is believing. They just see, and then if you tell them, if you see spirochetes in your mouth, there's no the moment you go out, you basically just book your next appointment, So I think it's just, it's amazing,
We had we did a survey to everyone before they came onto the call, and most people in the room spend well over 2,000 per calendar month on marketing. Some are 5, some are 10, and their patients have, on average, a medium. Some have a high engagement, but there were very few. There are some, and I know exactly that, but there are very few that have insane engagement. And I would actually say that what you're talking about is really insane engagement. It's patients who are really committed to your practice, you as a clinician. They're not going anywhere. No.
That's right. Yeah.
Do you know what percentage of rebooking you've got with the patients?
I think more than 90%, 95%. I think, it's amazing. Yeah, since we got this, we started this service in a practice of oral pathogen screening. I think I would say patient retention is more, patient cancellation is yes. And obviously, the practice has capacity of having more hygienists, and it just adds up.
I've got a couple more questions. Sanjay, you do a lot of implants, I know. Does this make you feel a lot more comfortable about your implant placement and management?
Sorry, come again?
Does the protocol make you feel a lot more comfortable about your implant placement and management?
Yeah, I think I'm more confident and more comfortable and relaxed a bit that the patients will get looked after well, and soon we are actually trying to implement some more training using GBT and Larkin's protocol to look after all our implant cases. The other day we just pulled out the list of patients of how many implants I did last year. I think it was around 500 to 600 implants. And I never, this patient needs obviously reactivation. Some of them have appointments, but we just don't have spot to have these 500 to 600 patients into the system. So
if anyone is on the call at the moment who wants to work for a fabulous dentist, please reach out to somebody.
Thank you.
I've given you a free plug there. We really want to find. I guess I'm going to have two more questions. One was, how easy was this to implement? And number 2, what can you see for your practice moving forward?
It was, I think, before you implement anything, I think you need to believe it first before you implement. So if you believe, then it's easy to implement. So, but I think the whole protocol is there's an online portal which has all the lectures where the whole team can go through all the lectures, and you can see exactly every single team member how many lectures they have seen, so you can track them so that everyone is on the same page. It was quite straightforward, and and moving forward, obviously there's tremendous opportunity, and at this stage we have 6 chairs. We just recently built a new practice. We have 6 chairs, and now 2 weeks ago, Meena, my wife, and I and Sue were talking about to have I wish we would have 4 more chairs, so we are planning to extend upstairs, have 4 more chairs, and have a 10-chair practice. So there's tremendous opportunity. It's just amazing.
Yeah, it's funny.
I think
it's funny we just built it and it wasn't big enough.
And I think the whole thing, the most important thing which fascinates me is just the oral systemic connection and how the patient sees it in front of them, the big screen. And imagine you having a biofilm test and you see those bugs swirling and moving around you, and it's just a straight impact. And Kate, our hygienist, has done so well. I'm so proud of her. I think we did the first 100. I think we must have done approximately 200 tests.
We've done over 200. Yeah.
Yeah, I think so. Yeah. No, it's good. Well done, Kate. I think she's